Morning to those of you in the Americas, good afternoon to those in Africa, and thank you to the National Academies of Sciences, Engineering, and Medicine for inviting me to speak with you today. And thank you to the panelists for sharing your perspectives and insights. The Partnership for Evidence-Based Response to COVID-19, or PERC, would not have been possible without the multidisciplinary strengths each partner brings to the table. I'd like to extend particular thanks to the National Academies for the support, academic rigor, and contextualization they bring to the PERC analyses. COVID has illustrated the importance of using evidence for decision-making in a public health crisis. PERC is a crucial tool for decision makers to help determine the acceptability, impact, and effectiveness of public health and social measures that slow the spread of the pandemic and mitigate its health and social and economic impacts. There's a common myth that the African Union member states escaped the worst of the COVID pandemic. The truth is that despite rapid and effective responses in many countries in Africa, limitations in testing capacity and surveillance are likely masking the true severity of COVID in Africa. The reality is that countries throughout Africa have suffered calamitous health outcomes, as well as crushing secondary societal burdens. Many African leaders responded quickly to the potential threat of COVID, but there's only so much public health and social measures alone can accomplish. COVID disrupted essential health services, with people reporting difficulty accessing medication and skipping needed medical visits. COVID-related barriers to accessing essential health services threaten progress in many health initiatives, including the critical areas of HIV and malaria. Secondary burdens of COVID continue to cause significant hardship. Income loss has worsened since the start of the pandemic, with 75% of those responding reporting having lost some or all of their income. Lower income groups have been even more heavily affected by income loss, while simultaneously, in some areas, being less effectively reached by essential social protection programs. Food insecurity is also increasing. More than 80% of respondents reported challenges accessing food in the previous week. That was up 8% from August. Adherence to public health and social measures which restrict social gatherings and mobility has declined across most member states. However, adherence to individual measures, and mask wearing in particular, remained high overall. But this varied among member states and trended downward in some of the most populous and hardest hit countries, including South Africa and Ethiopia. These concerns are being exacerbated by slow rollout of COVID vaccine. Limited domestic manufacturing infrastructure means that many member states must rely on other countries and multinational mechanisms to obtain and deliver vaccines. But people can't receive vaccines until the global community delivers them. What can member states do in the light of these findings? First, increase situational awareness. The capacity to track, analyze, and respond to changing disease patterns and excess mortality, worrying trends in India, Mongolia, Nepal, Uruguay, and elsewhere highlight the risk that Africa could suffer a deadly surge in COVID. Building in a watch function during preparedness can help countries ramp up response efforts rather than try to turn them on abruptly, ensuring earlier detection and faster and more effective response. Second, used evidence-based approaches to find and offer relief to high-risk populations. Maintaining population adherence to low-risk, high-impact public health measures such as mask use, keeping distance indoors when possible, limiting large gatherings will remain critical. Identifying when and where stricter measures are needed and implementing them swiftly in the highest burden areas will limit the economic harm such measures cause while still preventing the need for national level lockdowns. It will be important to offer appropriate social protection interventions to avoid the double crises of pandemic and famine. Third, vaccine supply delays present an opportunity to ramp up vaccine acceptance campaigns, coordinate logistics for more efficient rollout, and monitor vaccine confidence before vaccines become widely available. Transparency in decision-making and community engagement are both key. Respondents who were satisfied with their government reported significantly higher interest in getting vaccinated. Unfortunately, COVID will remain a serious threat to the African continent for the foreseeable future. If wealthier nations hoard vaccines and fail to share critical technology and expertise with Africa and the rest of the world, the global community will suffer, as will Africa. The global community must step up to increase vaccine production, ensure equitable allocation, and share technology with member states. Vaccines are our path to end this pandemic, but they're not a silver bullet. Global resources are also needed to increase capacity to detect, test, sequence, and trace cases, and to mount effective COVID responses. Finding and maintaining the balance between implementing public health and social measures to keep transmission low and minimizing the secondary burdens such measures cause will be critical in the continued fight against COVID. Thank you again to the National Academies for hosting this event, and to our panelists from the African Academy of Sciences for providing their observations and lessons learned. The COVID pandemic is unfortunately far from over, but by continuing to work together, we can develop, implement, and optimize the evidence-based approaches needed to better control COVID, prevent widespread outbreaks, and start us well down the road to both recovery and a safer, more secure world. Thank you.